Hi, everybody. This is Cindy Kennedy, and you're listening to another episode of Living with Lyme. We are going to be talking all about the thyroid today. We are here with Dr. Balcavage. How do you like that? Except that's not how you say it. You say Balcavage. His brother says it different as well, so it doesn't really matter as long as you say, hey, Dr. Eric, I got a question for you. He is the owner and founder of help me out. Rejuvagen. There it is.
Yep.
It's a functional medical clinic in Chadsford, Pennsylvania. So he's along the East Coast with me as well. He is a recognized speaker. He is an author. We're going to talk about his new book about the Thyroid Debacle. He is very skilled on a variety of levels, including thyroid. We talk about liver detoxification. We can talk about methylation. We can talk about chronic illness with him. His background is as a chiropractor as well as a certified functional nutrition person. We're going to flip the switch on him a little bit here today because he is the co-host of the Thyroid Answers podcast. So now we're going to be asking him all these questions, and we're going to get a lot out of this. And it's going to be really important because people don't understand thyroid. It's misinterpreted on many levels. And so getting the input from a functional aspect of it is going to be really important. And people listening to this may end up going back to their doctors and saying, hey, I listened to this podcast and I think you got it all wrong. So welcome to show, Dr. Eric. How you feeling today? I hope you're feeling okay.
I'm doing great. Thanks for having me on the podcast.
This is awesome. I got my lime green because we're recording in May and it's Lyme Awareness Month. So I want to be representing.
Well, I think I have a different shade of green, but I have a little bit of green on.
Yeah. Hey, I love that back wall of yours there.
Yeah, I did that myself. That's actually real.
Yeah, that's really cool. Guys who's listening and not seeing this, it's all
wood planking.
Wood planking, all different shades and really cool stuff. I love that. I like that type of decor, so I approve. So let's dig in here. The thyroid. Mm-hmm. Tell us a little bit about it. I actually just put a post out on Facebook a little bit ago on the thyroid because people aren't sure where it is, what it is, and what it does. So give us a description and some information on that.
So the thyroid gland is like this butterfly-shaped gland, like right in the middle of your neck. And your thyroid gland puts out a number of hormones, but the two primary hormones we think about are T4 and T3. And these are the hormones that essentially help drive the metabolism in the body. So when the body needs to increase its metabolism, increase energy utilization, generate heat, signals are sent from the cells to the brain. The brain sends signals to the pituitary to thyroid, and the thyroid produces thyroid hormones. And they circulate into the bloodstream, and then as the blood circulates, cells and tissues that need thyroid hormone are able to pull the thyroid hormone into the cells, convert T4 to T3, and then T3 binds to receptors inside our mitochondria and our nucleus and increase our metabolism. And so
it's so surprising. You think that it just kind of free floats around and it does all the job at the level of the thyroid, but that's really not the case. It really functions independently within the majority of our cells. Are there any cells that don't require thyroid hormone?
Almost every cell in the body has receptors for thyroid hormone. And whether those receptors are inside the cell or outside the cell, there's receptors for thyroid hormone. We're talking about, your podcast kind of centers around Lyme, and even from a perspective, most people would be familiar with, their white blood cells and their immune cells if they're dealing with Lyme, and even the immune cells require thyroid hormone to be effective and functional. And we can talk about that in a bit if you want.
Yeah.
And the impact that actually the deactivation of thyroid hormone plays in actually killing organisms.
Yeah, it's real interesting because some people end up having either Hashimoto's because they're producing some antibodies, or just generally an underactive thyroid. I know there are different types of thyroid disease. Will you describe each of them?
Yeah, so when we talk big picture, typically from an allopathic, a medical perspective, they talk about two types of thyroid conditions. It's either hyperthyroidism, which means your thyroid gland is pumping out too much thyroid hormone, or you have hypothyroidism, which means that the thyroid gland is not making enough thyroid hormone. And that's really the two classifications. There's really no, I mean, there's subclinical hypothyroidism and some other things, but really in the medical model, unless you have thyroid cancer, hyperthyroidism or primary hypothyroidism, there's no problem because there's nothing to actually treat or do yet, okay? And so it's thought that maybe 10% of the population suffers with some form of hypothyroidism, which is the most predominant form of thyroid disorder. I think it's probably much greater than that, but we don't really look at or assess thyroid physiology appropriately, in my opinion. And so when I look at thyroid physiology, I kind of break it down to glandular problems and cellular problems. And the glandular problems are similar to the ones I just said: hyperthyroidism, hypothyroidism, and maybe a cancerous issue or nodules or lesion, autoimmunity. They all kind of fall into that process that there's something happening at the gland. And then the other aspect is the cellular component. And we talked about, like, the thyroid gland makes the thyroid hormone and it goes into the bloodstream, but for thyroid hormone to really have an effect in the body, it needs to get out of the bloodstream and impact the cells and tissues, whether on the outside of the cells of our tissues or in the inside of the cells, which is what most people are familiar with. But it has to have an impact. And if you don't have enough thyroid hormone impacting what's going on inside the cell, then you're going to have signs and symptoms of hypothyroidism, despite possibly having a normally functioning thyroid gland and normal levels of thyroid hormone in the bloodstream, normal TSH, normal T4, normal T3, normal free hormones. Because we don't have a great tool to measure what's going on inside the cell. Probably the best thing we have is reverse T3 and T3 reverse T3 ratios. But we don't have any direct markers. I mean, we can look at proxies. Those could be proxies. Cholesterol elevation could be a proxy. Blood sugar dysregulation could be a proxy. We can look for inflammatory markers, but we really don't have a tool that says, hey, this is how much T3 is actually hitting the receptors. So what I think most people are struggling with is who are tired, they're fatigued, they have a chronic infection like Lyme, and they have those kind of hypothyroid symptoms, but their doctor says, hey, my labs are normal. They're struggling. Maybe their gland is working well, but what they're struggling with is a cellular hypothyroid condition, which is generating their symptoms. And the important thing to think about for the listeners is, it's not a mistake. This is a protective mechanism by the cells of your body to try and slow down metabolism, to actually try and protect themselves, to kind of wall off the organism or the toxin or whatever it is and prevent its spread and its activation. And so oftentimes when we look at something like a hypothyroid condition, we think that's the problem, and that's the outcome or the result of the problem, not the problem.
You know, it's funny because I heard you speak before. This was a bit ago, and you basically gave me permission to be tired sometimes, because you said it's really the body talking to you, slowing things down a bit, because there was maybe some healing underneath that needed to go on. And I said, you probably never heard me say it because I didn't say it that loud to hear me in Pennsylvania, but I just said, Dr. Eric said that my body's trying to talk to me, so I'm going to just take a nap here. And yeah, it made me feel better, because people think fatigue is always a really bad thing. But you think about it, anytime you have even a very simple virus and you're tired, it's an impact like you're talking about, the body trying to say, hey, slow down. We have to have additional work going on here, and you got to let it happen.
Yeah, I think the important thing for people to understand is that when there's some type of excessive cell stress, whether it is an infection, it doesn't matter what the infection is, but an active infection, whether it's toxicity, whether it's hypoxia, lack of oxygen getting to the tissues, whether it's prolonged disrupted sleep cycles, something is triggering an excessive level of stress in the cells where the cells actually start to perceive danger. And in that moment, cells have to change their physiology. They want to slow down the normal metabolism of the body and ramp up the defenses, which is called the cell danger response. And I usually explain it to my patients like, look, if you were cooking for your family and everybody was hanging around the island and you're cooking and you got all these pans on and everything's going great, and then somebody broke into your house and started attacking them, are you going to stand there and continue to cook your 3 or 4 pans of food, or are you going to go into defensive mode? And almost everybody says, well, obviously I'd go into defense mode. Right. Well, your body's doing the same thing. You can think about one pan is like your hormones. Why are my hormones dysregulated when I have an infection? Well, because you don't need those when you're in stress mode, right? Why is my GI tract not working right? Well, if you were being chased by a tiger, would you stop to eat? How come I have insomnia? I can't sleep. I can't get rest. Well, if you're being chased by a tiger, if you have excessive stress, your body is trying to keep you alert so that you can defend yourself. So we lose or reduce the less important aspects of our cellular physiology. We reduce the less important aspects of our whole body chemistry and shift the available energy to cell protection, inflammation, upregulation of the immune system. And we're so conditioned to try and push through those things and ignore those and say, I'm just tired, I just need coffee, I just need caffeine, I got to keep going. We're not listening to the signals. And, I'm no different than anybody else. It's what drove me to have some of my autoimmune conditions. Even though I was doing a lot of the right things, I was also trying to live on 4 hours of sleep. And you can't do that for an extended periods of time, especially as you get older, especially if you're endurance training and lifting and exercise, doing all these things. They are very healthy habits, but if you do a bunch of healthy habits, but then you have some really unhealthy habits like not getting good quality sleep, you're going to tank, and that's what happens.
Yeah, let's go all the way back. Let's go to the person who is actually going to the doctor with symptoms. Mm-hmm. And we know there's a difference between a general mainstream doc and someone like you or myself that practices functional medicine. But let's walk through the person who goes in with the symptoms and the doc does the lab tests and the findings that we would think would happen. And then let's take that and put it in a functional aspect and how you or I would take care of it. I think you understand what I'm asking for.
Yeah, so somebody's tired, they're fatigued, they're constipated, their hair's thinning, right? They're having a lot of what they would then Google and search and say, well, I'm gaining weight, I got constipation, I got brain fog, my hair's thinning. These are all the symptoms that we see as people having hypothyroidism. So I'm gonna go to my doc. And you go to your primary care physician and you tell him what your symptoms are, and he sees your hair's thinning and you're gaining weight, and he's like, yeah, sounds like you have a hypothyroidism. It's pretty common. So they're going to run what's called a TSH with reflex to T4 is the standard test, which means they run one test, TSH initially. And it's thought in almost all the guidelines, it's written up that TSH is often the only test that needs to be done. And it's the gold standard test for evaluating thyroid physiology. So if the TSH is normal, then no other test is going to be performed. If the test is abnormal, abnormally low, or abnormally high, then you're going to get the next level of test, which is usually a free T4.
So I just want to say, just so everybody understands, TSH is a thyroid stimulating hormone. This is from the brain. This is not coming from the gland itself. This is a whole access. It's this choreographed thing that goes on with our hormones. So we're just talking about a stimulation coming from the brain to talk to the gland to say you either need to make more hormone or less hormone.
Right. And so there's two glands above the thyroid gland that are really important, and it'll be very important in our discussion today. One is the hypothalamus, which kind of integrates all these signals from the body: inflammatory signals, leptin, food signals, satiety, ghrelin, all these signals coming to the brain. The hypothalamus integrates those and says, hey, we need more thyroid hormone or less thyroid hormone. If the body needs more thyroid hormone, the hypothalamus produces TRH, thyrotrophin releasing hormone. You'll never see that on your lab test. It's not measured at a standard lab. And then TRH is sent to the pituitary gland, the anterior portion of the pituitary gland, and the TRH stimulates the pituitary gland to produce TSH, which is thyroid stimulating hormone or thyroxine stimulating hormone, or thyrotrophin stimulating hormone. You'll hear it said a number of different ways, but it's TSH. And then TSH goes to the thyroid gland and kicks up production of thyroid hormone. So yeah, absolutely. But to your doctor's defense, they've been taught, and the guidelines, and there's multiple sets of guidelines, and they all pretty much say the same thing. If TSH is normal, you don't have a thyroid gland disorder. And in the current allopathic model, you don't have a thyroid problem or a thyroid signaling problem as long as TSH is normal. You don't develop a thyroid problem in your cells until the gland doesn't work anymore. And so you're going to leave there frustrated. Might be told, hey, you need to eat less, you need to exercise more. Maybe you're just depressed, or you're crazy, or whatever. And so what you see people do is then go out and reduce their calorie load, right? Work out really hard, and then they can't lose weight. They actually start gaining weight because they're probably dieting versus doing something more beneficial, like maybe time-restricted eating. They're working out excessively and probably inappropriately in how they're doing their cardio workout, and they're gaining weight. And so now they're more frustrated. They go back to their doctor, and the doctor runs it again and says, nope, you don't have it, you don't have it. Then they'll show up in our office, right? And the difference is when you come to a functional medicine practitioner, we're not really following the same guidelines. And so what you should see, my opinion, from a standard functional medicine, from a good functional medicine practitioner, is they're going to run what's called a comprehensive thyroid panel. Now, you and I both know that everybody thinks they had a comprehensive thyroid panel. My doctor ran a comprehensive panel. Yeah, it was TSH and free T4. That was it. But there's TSH, T4, T3, free T4, free T3, T3 uptake, free thyroxine index, reverse T3, TPO antibodies, thyroglobulin antibodies. They could run thyroid binding globulin if they want to. They can run TSI antibodies. There's lots of tests in the thyroid panel, and they all have value, so that we would want to take a look at all of those. And I would say, from my opinion, and you may or may not agree with me, that it should be done along with a comprehensive metabolic panel, which is test your glucose and your fasting insulin and your lipid levels and your uric acid and CRP and homocysteine and your iron levels. And so we want, in functional medicine, this 30,000-foot view of what's going on. And in allopathic medicine, where insurance is often setting the standard of what can be done, and if a doctor goes outside of that, they get their hands slapped, and patients get a big fat bill. We're saying, hey, you need to run these tests, because if we want to identify whether you've got a thyroid signaling problem but a healthy gland, we not only want to have the thyroid markers, but we also want to have the other lab markers to say, hey, not only is your reverse T3 elevated or the ratios are off, but your cholesterol is elevated. That's a common symptom of low thyroid hormone in your cells. You're insulin resistant. That's a common sign of hypothyroidism in your cells. You've got multiple inflammatory markers elevated that would cause the deactivation. So it gives us all of the kind of background story as to not only is there a cellular hypothyroid condition, what may be causing it or contributing to it, and the impact it's having on multiple systems in the body.
Is it the chicken or the egg theory? You know, what came first?
I would,
Did
yeah.
somebody's gut get really messed up? You know, a Lyme person on antibiotics for way too long, you know, causing gut permeability, people with very low vitamin D levels, you know, their antioxidants are down. Is it a chicken or the egg?
Well, I think when it comes to thyroid, I would say that the thyroid glandular hypothyroidism is the end stage, not the beginning. So that's important for people to know. But when they get diagnosed with primary hypothyroidism, they've lost 90% of their thyroid gland function. So that is not the beginning of a thyroid problem. That's the end of a thyroid problem. And one of the biggest problems with TSH, when we were talking about that, just to bring that point home real quick, is doctors are taught it's the gold standard, but TSH can be suppressed, which means it'll lower the value, keeping it looking normal by the most common problem we have in this country, which is chronic low-grade inflammation. So if you're a person who's, let's say, has Lyme disease and you have chronic inflammation as a result of it, it's going to hide your thyroid condition if your doctor's only running a TSH. If you're taking blood pressure medications will suppress TSH. If you're taking metformin because you've been told you have a blood sugar problem, you have the blood sugar problem because you have a cellular hypothyroid condition, and the metformin will suppress TSH to hide the glandular disorder. So it does become this vicious cycle and problem. But I think when people start to consider hypothyroid problems, and whether somebody like you or I diagnose it, or they have a glandular disorder that gets diagnosed by medicine, the solution is rarely ever to treat the thyroid gland or to put more thyroid hormone into the system. For you, both you and I think as functional medicine practitioners, and for any of our fellow practitioners, our peers that are listening, when you see that the person's got a hypothyroid condition going on, whether it's cellular or glandular or Hashimoto's, the easy answer is to say, we'll just give them thyroid hormone or selenium or tyrosine to make it work better. But that's like trying to put more gas into a car that doesn't run well because there's no oil in it. You're addressing the wrong thing. So the car's not running for some other reason than gas, and you're thinking that gas will fix it. It won't. But chronic infections are often at the root of what's going on. And I think one of the things when it comes to chronic infections is, are they the beginning or are they the result, right? Which I think ultimately gets to your question, do we develop, if it was just the infection, right? It was just the organism, you wouldn't have a housewife in New York, right, who doesn't go outside, has no pets, no animals that would develop Lyme. And you would have everybody who spends time in the woods like I do who should have Lyme, right? Because I've got a greater exposure. But if I'm out there, I'm in it, I'm guaranteed I've pulled off a ton more ticks than maybe that housewife who's living in a high rise in New York. Why am I not getting sick, right? Why is that person getting sick? And organisms have a tendency to thrive in an environment that's conducive for them to thrive. So if the immune system's run down, if the body's compromised, then yeah, organisms are going to get into the system and they're going to proliferate. We're seeing that right now with what's going on, right? We look at the people that are getting sick with COVID-19, and we're saying we're taking a look back and saying, wait a minute, there's groups of people who are more susceptible. They're the people with diabetes, the people on blood pressure medications, the people who already have immune compromise. That would make sense to me. These are people whose immune systems aren't healthy and they're not adaptable to their environment, and so they have a tendency to get sick. So even when we have somebody who's got Lyme or a virus or dysbiosis, I think it's important to help try and knock down the virus or the bacteria or the spirochete or whatever it is. But if that's all we do, the problem's coming back. We have to change the environment, the terrain. And that's where in the book that we have coming, Kelly and I have coming out, we talk about these fitness factors, the aspects of health that are foundational to anyone and everyone. Doesn't matter what your diagnosis is. These are foundational concepts that everybody needs to work on becoming more fit in.
Yeah, I want to talk about some of those foundations, but I do want you to explain the body's ability to produce TPO, thyroid peroxidase, antibodies, or thyroglobin, thyrotropic.
Globulin antibodies?
Yeah, I mean, you got a couple of types of antibodies that will kind of go under the topic of autoimmunity. And autoimmunity is not necessarily the body killing itself, but can you explain the two types and how or why do they present themselves?
Well, my take on this is probably a little bit different than a lot of people. I think there's 10 hypotheses or theories about autoimmunity, and I think they all leave out probably the one most important one, and how I look at thyroid physiology. And if you look at it, that the body is not, I just don't think the body's stupid. We came from 2 cells. We've been around for, millions of years, right? And so there's something unique about the physiology, and there's innate intelligence to the physiology. So when there's this excessive cell stress response, what we typically see is this cell danger response kick in. And that cell danger response, if it becomes persistent and prolonged, the cell danger response kicks out what are called, definitely kicks out inflammatory molecules, and that signals all the surrounding cells that says, hey, there's a problem, start defending yourself. Just like if somebody was robbing my house, I would want to scream out to my neighbors, hey, there's somebody attacking my house, lock your doors. The same thing happens at the cells. And if it's short term, it's not a big deal. The infection probably stays located. The cells, the immunity, the immune system, it addresses it. But if it becomes prolonged and constant, then we start to get the release of these things called DAMPs and PAMPs from damaged cells. And DAMPs are damaged pieces of the cell, and PAMPs are pieces of the organism that are jettisoned outside the cell to alert, and they're sent out into the bloodstream to alert the immune system to say, hey, this is what you're looking for, right? If it's my damaged tissues, come clean me up. If it's a part of a organism, this is what you're looking for. And the body can make some antibodies to those things. And so in my way of looking at what happens at the thyroid is, hey, we have the cell stress, it starts locally, and it becomes chronic and persistent. And instead of cells just trying to slow metabolism down in trillions of cells locally, we can just do it globally. And the best way to do that globally is to slow down the thyroid gland itself, to slow down metabolism. It's like I can pinch a hose to turn it off, or I can turn off the valve, right? If I only need the water off for a second or two, I'd pinch the hose. But if I need it off for hours on end, I would turn off the valve. And so what happens, these DAMPs and PAMPs are released to the bloodstream, and the thyroid gland just happens to have what we call pattern recognition receptors, which are little sensors, so that when there are enough of these DAMPs and PAMPs are circulating in the bloodstream, they can actually start binding to the receptors in the thyroid. And now the thyroid cell actually acts like an immune cell. And it actually starts to release pieces of damaged thyroid cell. It releases inflammatory chemicals out into the bloodstream and actually invites what they call the lymphocyte infiltrate into the thyroid gland, which is actually what creates a lot of the damage. And so it's these inflammatory cells, immune cells, white blood cells that come into the thyroid gland, start creating all this damage and debris. And then that damage and debris is sent to the immune system to say, hey, we got to clean this stuff up. And now we have particles of TPO, thyroglobulin, that the body starts to make antibodies to. And so that process can go on for weeks, months, years before the gland becomes so broken down and so inefficient that TSH rises above lab range, T4 drops below lab range, and a person's diagnosed with primary hypothyroidism. But if you think about it, it's more of a protective response, at least initially, than it is a mistake of the body. So when we're talking about, hey, my thyroid antibodies are elevated, my thyroglobulin antibodies are elevated, they're damaging and destroying my thyroid gland. Well, the literature doesn't really show that that's the case. It shows that maybe the thyroglobulin antibodies don't create any damage to the thyroid gland at all. And it's a very small amount of damage is actually done by TPO antibodies. Most of the damage is done by the inflammatory molecules, by the thyroid gland cells themselves, or that infiltrating white blood cells that come into that area. And
yeah, that's important, because that actually helps us to understand why people can have, you know, a climb in their TPO antibody and then it goes back to a normal range, because it's not always a forever thing, right?
correct. I mean, I had Hashimoto's and you know, I made the changes that I needed to make for my health in my life, and the antibodies went away, you know. So and I see that in my patient base. So the issue is, when somebody sees thyroid antibodies, and we see this in like functional medicine blogs in space, right? People are like, you need to lower it, you need to jack this, you need to do that. What we should be thinking when we see thyroid antibodies is, hey, there is something that's triggering damage to the thyroid gland due to some type of stress. It's a toxin, it's an infection, it's poor sleep, it's poor respiration. Something is telling my body to slow my metabolism down, and I got to figure it out. Trying to artificially suppress your antibodies doesn't fix that. So that's what it should tell us, and that's what we should be looking at, is saying, oh, I got elevated antibodies. I got to take a look around to see what I'm not doing well with and fix those things.
Right. It's the whole upstream approach, you know.
Yeah.
Just because it's happening doesn't mean it's supposed to happen. It probably means there's some other reason that is leading to this occurring. Let's talk a little bit about what information is a T4 versus a free T4, a T3 versus a free T3, as well as that reverse T3, which has been probably a big eye opener for me as I start doing these lab values with people, because of the elevation of that. So let's talk about that. What do you like to look at? What is the biggest bang for your buck from those?
Well, I think you have to look at all of them in perspective, because you can't look at reverse T3 on its own. Like sometimes I'll have people say, well, my reverse T3 is normal. I'm like, well, what's your T4? Well, I didn't have it done. Well, then you can't use reverse T3. So T4 is, the thyroid gland puts out two primary hormones, T4 and T3. You know, close to 90% is T4. It's what we consider a pro-hormone. That's not totally true, which means it has to be converted into something else to really be functional. And it's technically not true, but it's the best word we can use for now. And then T3, the thyroid gland makes a small amount of it, maybe 10%, is the active hormone that actually gets inside the cells and does what we call most of these genomic changes in the body, okay? So think T4 and T3, most of what the body makes is T4, and you might say, well, why would the body make mostly a hormone that's not ready to be used right away? And the answer is, it's really the backup plan. So if your cells and tissues need thyroid hormone like right now, there's always some level of circulating reserve, so that we don't have to go through the whole machinery of the thyroid gland being kicked up. There's always some circulating. So that's what T4 is. T3 is the ready to go form. And we don't want a lot of it, because if we have a lot of it and it becomes what we call free hormone, then that can hyperstimulate tissues. So most of the tissues in the body prefer to convert at least 50% of their own, or make 50% of their own thyroid hormone based on what's happening inside the cells. Some cells and tissues have to have T3 because they can't convert T4 to T3. So there's a reason why there's some T3 that circulates. So when you look at a lab report, you'll see T4 total, T3 total. That's how much is in circulation. And that's important to know. The other test that you'll see on there is free T4 or free T3. And free T4 or free T3 is no longer bound to the transport molecule, and it's actually now available to be used. I try and explain total T4, which is like all the thyroid hormone, but most of the thyroid hormone's in a bound state. It's like it's in a car. If you called Uber to take you to the mall, right?
Yep, I love it. Analogies are the best way for people to understand it. They need to visualize it. So, so go ahead. Yeah.
So the Uber is like the carrier molecule.
In the car.
Yeah. And if I drove you to the mall and I let you out of my Uber, you are now free to go shop, right? But if you're staying in the car, then you're not free, you can't shop, and that becomes the problem. So we want to know what the total amount is. That's how many people are in the Ubers, like driving around. And then we want to know what's free, how many people are able to get out of the car and go shop. Because you can only do some thyroid stimulation when those hormones become free. So free T4 and free T3 are really important. And then there's a couple other markers, but the one that you mentioned is reverse T3. You'll rarely ever see an allopathic physician run it, I think for a couple reasons. They tried to use it and they didn't understand. I don't think they really understood what it was or how to use it appropriately, so they just disregarded it. But reverse T3 is the inactive form of T4. So T4 and T3 are circulating, they can get to the cell. And once they get to the cell determines, are we going to activate it or are we going to deactivate it? It would be like you got out of the Uber, you got to the mall, and the guard at the mall said, no, you're not shopping, or you're coming in, right? And so there's another layer of support. So if a cell does not want to have its metabolism increased, it'll convert T4 to reverse T3. It'll convert T3 to one of 4 forms of T2. Now, we can measure reverse T3, but we don't measure the T2s in a regular lab. So you'll never see those on a lab report. So the only one we really can look at is reverse T3. And so to ask your medical doctor to run it is probably not going to happen because they wouldn't even know what to do with it if it was elevated to begin with. But for you and I, it would be very important, especially for somebody who has Lyme. We would look at that and say, okay, your TSH may be normal, your T4 and T3 and free T4 and free T3, they may all be normal, but what we see is that your reverse T3 is starting to elevate, which means there's something happening at the cellular level that's causing thyroid hormone to be deactivated. So there must be some type of danger response going on, and we want to go look and identify it. Now, somebody may say, well, I know I have Lyme disease. And so the quick thing that we got to watch for is sometimes people are like, well, we want to do some things to try and lower the reverse T3, like to artificially lower it. Like we're going to stop giving you T4 and give you T3 because then you can't make reverse T3. If you understand, especially in an infection state, what reverse 3 is doing, it has, even though it's supposed to be a non-active thyroid hormone, it does play a role. When cells deactivate thyroid hormone, it pulls off an iodine molecule. Now, iodine is an antimicrobial, right? If somebody's going into surgery, what do they wipe on somebody's skin before they cut it? They wipe iodine on there, right? So iodine, when we see elevated reverse T3, one of the things we should potentially consider is there may be an infection here, right? There may be, and it doesn't matter what it is, but there may be some type of infection. White blood cells have thyroid receptors, they have thyroid hormone in them, they have deiodinase 3, which is the converting enzyme to deactivate it. And you're familiar with MPO and lactoferrin, and these are little molecules inside the granules inside white blood cells. And when you mix iodine with MPO, you actually help produce hydrogen peroxide and hydroxyapatite, which then can kill organisms. So we have to look at that reverse T3 and say, why is it elevated? Not down, but why is it elevated? And it should alert us that there's probably some form of danger, and especially if there's some type of Lyme issue going on. Hey, that makes sense. I have Lyme, I have a chronic infection, my reverse T3's up. Should I really be trying to suppress this, or I just need to be aware of it and start addressing what the potential triggers are?
It would be really neat if you were addressing someone's thyroid problem and they still didn't have a diagnosis of Lyme, and you see that this reverse T3 is up, and you kind of put the pieces together of the puzzle. Most of the patients that I see for Lyme disease, especially those who are not acute, which we usually don't get the acute people because they're obvious and they get the care they need. It's the chronic people, and they'll show up and their reverse T3 is elevated. And you already know. I mean, it's a given for the reason that you just explained, that
Right.
that there's an underlying problem, and you know what the underlying problem is. You're going after it. The thing that is very hard for people to understand is it's not going to take 6 weeks for that to completely get back to normal. When you've got all of these damps and pamps going on, it takes a while. It's like peeling back an onion. And I think that people get really upset about that because people have got lives to live, and maybe they've been sick a while and they just want to get on with it. And it's a process. It's a process for the body to heal and for the body to kind of put out some of those fires. Now, let's get back to the foundations. And I bet you and Dr. Kelly.
Right.
What's Dr. Kelly's last name?
Alderman.
Yes, that you wrote the Thyroid Debacle with. You told me about the foundations. So talk to me. I'm assuming those foundations are the same thing that I'm thinking about, but I'm going to let you explain the foundations of not only healing your thyroid, but staying well. Is that what we're getting at?
Yeah, I think what happens many times people get sick, they don't feel well, they've been through the allopathic model, that doesn't work. So now they come to the functional medicine model, and what they're hoping is that you have a secret supplement that's going to fix it for them. And it just doesn't work that way. Patients, they're frustrated, they've probably been sick for a long period of time, and they want a quick and simple solution. But supplementation, should not work that way, and that's not what functional medicine should be. And so what we talk about in the book is, we talk about a lot of things in the book, but one of those things we talk about is the place for everyone to get started is with foundational concepts. So we talk about 10 of those in the book. One of those is diet, right? Right now, there is lots of discussion about what's the best diet for people. Is it carnivore? Is it keto? Is it AIP? Is it vegetarian? And the answer is maybe all of those or none of those. Right? What we need to do, and what we try, and Kelly and I put people on AIP, low histamine. I put them on carnivore. I put them on vegetarian. I put them on every type of diet. And the thing I'm trying to do when I'm working with them is find what's right for them right now. And that may not be the right diet for them 6 weeks from now, 12 weeks from now. But from a foundational concept, you have to have good dietary fitness, which means to me that 80% of the time you're eating whole food as close to its natural state as possible. And 20% of the time you're eating processed food, you're eating foods that are not great for you, but they're enjoyable, right? And I talk about in the book quite a bit, and I talk with my patients, you should have healthy habits and periodic unhealthy behaviors, right? Healthy habits, unhealthy behaviors, versus lots of unhealthy habits and a few healthy behaviors. So I'll give you an example. If 5 days a week you're eating lunch, breakfast, at a fast food restaurant, and then, 1 or 2 days a week, or, 20% of the meals you eat like a home cooked, like vegetable and a meat source, right? Something that's, most of us would consider healthy, then you don't really have healthy eating habits. You have unhealthy eating habits that are sprinkled with healthy eating behaviors. You're never going to stay healthy that way or get healthy that way. I talk to people all the time and about, whether it's exercise or anything else, you have to improve. And what I say fitness, like your level of how your fitness, if you have poor dietary fitness, then your diet is dominated by unhealthy foods. If you have high dietary fitness, then your diet is dominated by healthy foods. And so I think that for anybody, before they even reach out to a practitioner, that's one of the foundational things they can do. Hey, let me stop eating donuts and cereal for breakfast. Let me stop eating fast food for lunch and pizzas for dinner on a regular basis, and let me get some whole food in there, some meat, some fish. Let me get some more vegetables into my diet, and make that decision. So that's a foundational concept. We talk about sleep as a fitness, what we call one of our foundational fitness factors, and sleep's critical. And this was a problem for me because I had so many things going on. I was kind of thought that I only need 4 hours. I could sleep when I die. And I didn't realize the destruction it was causing by not allowing me to recover. And that's one of the biggest factors that led to, me developing some insulin resistance and Hashimoto's. But we need to sleep about 7 to 8 hours uninterrupted on every night. And far too many people don't consider how important sleep is. And they don't have a sleep habit, a really healthy sleep habit, a high level of sleep fitness where they go to bed at a set time, get up at a set time. They don't cheat it at either end. They're 2 a.m., 3 a.m. because they're watching TV or looking at Facebook or Instagram or whatever, and they're cheating it, and the brain needs it. The body's ability to heal and repair needs that sleep. That's when most of the repair process is occurring. We talk about respiratory fitness. How you breathe is critically important to your well-being. What we see when we test people is that they don't have good breathing habits. They typically breathe out of their mouth versus out of their nose. They wind up developing what we call cell hypoxia, which is a danger response. So it's really prevalent at night when they're sleeping. We talk about emotional fitness, which is what happens in the 6 inches between your ears, right? Everybody talks about stress. There's lots of different forms of stress, right? But stress and what happens around us or what happens to us is not as much the problem as how we perceive it to be, right? And so we work on that quite a bit. We talk about metabolic fitness, and this isn't something that most people are going to be able to evaluate on a practitioner should help you. Like, what aspects of your metabolism due to your excessive stress have already become compromised? Blood sugar physiology, adrenal physiology, gut physiology, hormone physiology. We talk about habitual fitness, which is what are your daily habits from the time you get up to the time you go to bed. Most people really don't consider that they have bad habits until you actually start taking a look at them and say, yeah, I do that every day. If you're spending 2 or 3 hours on your phone and social media a day, that is not a good habit to have. We talk about physical fitness, like what's your physical activity level and stability, and we just walk through those things. But I think as a functional medicine practitioner yourself, these, I'm sure, are the same concepts that you try to get through to your patients and get them to engage in, and they're the hardest things to get people to do, and they're free. Almost all of them are free. Before somebody should reach for the next supplement to what supplement's gonna fix it, how about you do some breathing exercises? No, I don't wanna do that, right? I don't think that'll work. but it is these free things that are foundational and have to be done before we can do anything else.
It's true. It's true. It's the simple things, but for people, it's huge. It's huge. When I practiced gynecology and, people had long-standing issues, they would get so upset, but they wouldn't try to change anything. Some simple things, like let's do one thing, baby steps. Let's remove all the sugar from your diet. Well, I can't do that. Well, why can't you do that? And it's a mindset. These people are just, they're stuck in the habitual phase. When we talk about food and nutrition and whatnot, I go into the hygiene of the food. That's how you prepare it and how you put it in your mouth and how much you chew it and how you swallow it, and talk about stomach acid and all that. And people like blown away. Some people don't care, right? You're always
Right.
going to get those people, but some people are like, wow, I never thought of that. That big jug of water, you really need to drink some of that before or drink some of that after, but you don't drink all that with your meal because you're going to dilute your stomach acid. And
Right.
talking about the sleep issue, it's frustrating, and it is that constant kind of wheel that keeps turning, and the more you don't sleep or the more you wake up, the more anxious you get. But the more anxious you get, the more sympathetic response that you get, then you are waking up. So it's trying to kind of reinvent what they should be doing. And we, in my practice, we talk a ton about screen time and mindfulness. Cute story. One of my gentleman patients, I said, have you ever learned or practiced mindfulness? And he goes, I don't even know what that is. And I said, okay, just stop. I want you to feel the chair. I want you to sense the room. What do you hear? What do you see? He goes, oh, I have a comment. And I said, yes. He goes, you see that? You see that fake tree in the corner over there? I see it and I know it's too small for this room. I go, bingo, you did it. You did it. You were aware. And that kind of thing is important. People have never been taught that. It's interesting. There's more theories, and they're talking to children and getting them in tune with their body with some yoga, and they are teaching some of this mindfulness in school. I think it's important, and I'm hoping that's going to bring about a lot more health in people's lives as these youngsters get older. But it's difficult because it's the habits that we formed for years that are very difficult. And I found that some of my earlier patients, I was so zealous, right? I was so zealous. I got to get it all fixed in one visit. And
Yeah.
I did a disservice because it's so overwhelming. And I think anybody that's making changes or working with a functional person, it's not a one and done. It's just not, no matter what the problem is, unless unless I don't know. I can't even think of one problem that could be
Yeah, I
done.
think for the average person who's got some type of chronic illness, I think you said this early on, and it holds true, is that we're like onions, right? And when we're trying to help somebody, we actually have to peel back the skin. And for you and I, we want to look at their, like, what we call your health timeline, which is your story from like as far back as you can remember and write out. And people hate to write that timeline. Some people are like, oh, they have 2 sentences. Other people have like 2 books, right? They'll have everything. So, but that timeline tells a story of how you got to where you are. You may just got Lyme, right? Hey, I now have Lyme. And somebody might say, okay, we'll treat the Lyme. I think you and I would look at that differently and say, look, we got to go back and allow what got you to the point where you got to a point where your body was accepting the Lyme and allowing it to thrive in your body. We have to figure that piece out. So yes, we may need to do some things to manage or support the body's ability to try and kill Lyme, but we also have to get to the root issues as to why this occurred in the first place. And when you get down to it, it is all these little aspects of health and lifestyle that we don't pay attention to. And you're really right when you're talking about people aren't really aware of, what's going on. They're not very in touch or in tune with what's going on around them, with their mindset, and doing that type of work. And it is, we're so caught up in these things, right? These devices in everybody else's life that we kind of don't put enough attention to our own. And maybe we're an escape from our own, but it is getting in touch with what your body and your surroundings are telling you, that really helps you come to, especially to emotional stress, to come to a calm state and a calm position. We spend more time inside than we ever have, more, and that's one of my concerns about what's going on right now. But the more time you spend outside, the more time you spend in nature, the more you become aware of things you may have never even considered, and you become way more mindful of what's going on in yourself and around you.
Yeah, this whole COVID situation has really forced people to really step back a little bit, a lot of it. And really, and it's funny because in a healthy way, I'm active on social media, and I've just been begging people, you're going out, you're walking some trails, you're doing some hiking, please do tick checks, please, just keep on telling people. And I keep telling people too that if you find a tick, take it off, let's send it out for testing. That can allay so many fears, if it comes back negative. And it's about educating people. I don't know about Pennsylvania, but Massachusetts, people don't get the functional aspect. They don't get the point that a lot of functional people are fee for service, because we really want to spend an exorbitant amount of time with our people and really get to the root cause. And if I, were taking insurance, I don't think I could do that as effectively and efficiently. And trying to convince people that it's money well spent sometimes is very difficult. It's very, very difficult. But I think by educating people more, talking more about it, getting people to listen more, your podcast has got to help a lot of people. Your new book, The Thyroid Debacle, is that available now on Amazon?
We are in pre-order now, so if anybody's interested, they can go right to Amazon, and I think I sent you the link, and they can just pre-order it on Amazon. So it should be out sometime this summer. Yep.
Okay, that'll be great, because I'll go back and I'll make sure I add it in when we put the podcast on the website. And the podcast is available through iTunes and Google Play and Stitcher Radio and all of those platforms. So it's very good to have a variety of ways people can access this. And I'm excited. I want to have you back. We got a lot of different things, because you talk about detoxification, and we're talking detoxification at the cellular level. We're not talking about sweating. We all know that's a healthy thing, despite the fact that, we think it's very unfeminine if we perspire. But we've got to get back. We've got to talk about this cellular detoxification. And, I really want to mention something. As you were talking, and we're talking about stress on the body, emotional, there is physical stress. And people don't realize that if they are excessive on any level, especially hard on your body with exercise, that actually causes more free radicals, and you have to detoxify those. So it's interesting, because somebody who's well known, obviously I have to keep it's not a HIPAA thing because it's been out on the news, but somebody in this COVID epidemic, somebody that everybody looked towards, was like, I was the picture of health. I'm in my 40s. I, eat well. And then he started talking about how he runs 10 miles every day. And how could I have gotten COVID? And I'm thinking to myself, I'm wondering if that's just too much. What do you think about that?
Well, couple key points there. One is that I'm an endurance athlete, right? So I run, I lift, I do all the, do all of those things. And I think that's okay to do, but you actually have to allow for rest and recovery as well. What drove me to have hypothyroidism and insulin resistance and Raynaud's was the fact that I was overtraining and under recovering, right? So the exercise itself wasn't terrible, but I wasn't giving myself time to recover. Plus I had all the other stressors. So essentially what I did was I just broke down. My body just couldn't adapt any further. And so there are a lot of athletes who look physically fit. And when we talk about those fitness factors, yeah, they may be a 9 out of 10 for their physical fitness, but their metabolism may be a disaster, right? Their GI tract. I know a lot of people who are endurance athletes who have chronic IBS because their metabolism is compromised. So just because you exercise doesn't mean you're healthy. And there's many factors, and we talk about those 10 factors in the book, and you've got to have an above average level of fitness in all of them to be able to have good health.
Right, not just one category.
Exactly. And then the other part of it is, you hear people saying, I'm extremely healthy and I got sick. Well, I don't think we have a valid diagnosis or definition of health. When you ask people what healthy means, the average person can't even come up with a definition. Like, I don't know, you eat well. I don't know, you exercise. I don't know, you're not overweight, right? So if you ask a doctor, they'll state, it is mental, physical, and chemical well-being, and not necessarily the absence of disease, right? That's the World Health Organization. What the heck does that mean, right? So the problem is we have to have a new definition, or we have to have an agreeable definition. And when somebody looks up healthy, it says somebody with a high state of wellness. Okay, so let me go look up wellness, somebody who's healthy. And so the problem is, right, we keep using the same terms to define each other, but we're never defining the actual term. And in the book, I struggled with this, is to really come up with a definition of what I thought health was, right? This is this state of adaptability, self-reliance, right? And so, and it's kind of a continuum. You can have very low levels of health, or you can have very high levels of health. And when people say, well, I'm healthy, I just take 4 or 5 meds, well, then you are not self-sustainable, right? So you aren't healthy. You have a below average level of health. And so if you're healthy, you can adapt to your environment, right? You're adaptable to your environment, and you can self-sustain in your environment. And that's kind of average health, in my opinion. But you also have that person who can, they're sitting at a desk, they don't do any exercise, they don't have much stress on their system. They're healthy for their environment, right? Mm-hmm. But if I had them go do, hey, we're going to go climb a 8,000 foot peak, they would never be able to do it, right? So as you are not just adaptable to your environment, but you're adaptable to more challenging environments, whether that's food, whether that's organisms, whether that's physical fitness, whether that's lack of sleep, like whatever those challenges are, you can adapt to them and thrive. And that's the other piece. You have to be able to adapt, you have to be able to thrive in your environment, and you have to be self-resilient. And every time I think I'm 52, I'm probably as fit as I was in my 20s or 30s. But every time I feel like I've hit I'm pretty good, I always know there's somebody who's fitter, and there's a higher level of fitness that I can go to. And so it's like, okay, there's another gear. And that's the challenge, I think, for a lot of people who are struggling with chronic infection, whether it's Lyme or anything else, is they can't even perceive that they can get to that level, right? I can't do exercise. Well, you can't do an hour of it, but you could do 30 seconds. And so let's start with that, right? I can't even eat that food. I don't even like to, let's just try it for one, we have to help them along that way. I think you talked about this before about like physical fitness, and people don't have time. People don't make the time because they don't enjoy it, right? Or they don't know what to do. But it's a habit of mine. I get up in the morning and I go for my run, or I go do my yoga, or I do whatever. But during the day when I'm sitting at a desk or standing at my desk, I talk about this in the book. It's called 20-minute fitness. Every 20 minutes, my timer goes off and I do something. Today, this is different from my normal lift. I just get up and do something. So today has been, curls. As soon as the timer gets up, I get up from my desk, I do 10 curls, I put it down and reset the timer. Yesterday was, what was yesterday? Yesterday was crunches. The day before that, it was squats. The day before that, it was pull-ups. The day before that, it was lunges. But it does a couple things. If you don't have a half an hour or an hour, and every 20 minutes or 30 minutes, I don't care what it is, you get up from your seated position, you move some blood around the system. Even if you did 5 air squats, right? Or holding onto your desk doing a squat and then sat back down again, even if you missed half of the buzzers through the day, you'd probably still do 100 or 200 squats by the end of the day.
Oh my God, that's amazing. That's amazing. I mean, we've been talking an hour. We're behind 3 times.
Right.
Oh my God, I'm so sorry to have kept you so long.
But you know what I mean? And so, but there's time there. There's always a way to do it. But sometimes when we're stuck in our place and in our mindset, we don't see that there's a simple solution. Yep. And there always is. And that's where I think for us in functional medicine, we're trying to help them understand that these are foundational concepts. We have to find some way to get these things in. There is always time, because if you ask the person who runs 20 miles a day, could they give you another 5 minutes to exercise? They would say yes, right? And so you can always get it in, and all these things are important. And I think the last point on that topic is people say, well, I don't like to do it. Well, that's why you need to make it a habit. Listen, it was raining this morning. I didn't feel like going for a 9-mile run, but it's my habit. It's what I do, right? So you just get up and do it. I hate yoga, but I do it on Wednesdays and Sundays, even though I hate doing it, because I know it's good for me. It's just on the schedule. It's the habit. It's the discipline. And I think that's what most people who, especially those who are struggling with chronic health issues, is get with a functional medicine practitioner who can help you build healthy habits. You don't need motivation. You need discipline. When you have discipline to do it, you don't need motivation. The motivation actually comes after you finish that and completed it. Then you go, wow, that was awesome. I may do it again. But you need to have the discipline.
Wow. You made me feel bad about myself. Thanks a lot.
Sorry about that.
This has been an awesome interview. And, I'm excited to see the contents of that book of yours and see how it can give me some key pearls in helping my patients. And, exactly what you just said was a really good thought about lots of little things, little movements kind of all add up. And I don't talk about exercise a lot with my sickest people. I talk about movement. What was your movement? Mm-hmm. Some people get confused. They start talking about their bowel movements, and I'm not, no, not those. I want to know your body movements. But that's great. That's so great. Dr. Eric, it was wonderful. And we definitely have to have you back. I do want to talk more about detoxification and all. And I hope that you stay very healthy and very well there in Pennsylvania. And I will put all your information on the website. And you do have a very great bio. So I encourage you to read a little bit about him and how to acknowledge how he's doing great with this book. Maybe it's something that you really want want to put in your bookcase after you've dug deep into it. And certainly there'll be information on how else you can reach Dr. Eric. Thank you very much. And for everybody who's been listening, this is another episode of Living with Lyme. It's May, and it is awareness of Lyme prevention. So do make sure you check yourself for ticks. And I hope that you come back real soon, listen to another episode. For everybody, take good care.